across the pond, where all across Europe, numbers are varying quite dramatically. Italy now becoming the new virus hotspot, both in confirmed cases and death toll. Meanwhile, German Chancellor Angela Merkel goes into quarantine after the realization that her doctor tested positive for COVID-19. But Russia, who shares a border with China, where the pandemic is believed to have begun, has only had infections in the low triple digits. So joining us to discuss, former UK MP George Galloway. George, good to see you, happy and healthy. Across the EU, the disparity of these confirmed cases is just so wide-ranging. Why do you suppose that is?
Well, of course, there's a curve, and people are at different stages in the curve. It's a truism here in Britain that we are 2 weeks behind Italy, in which case there's going to be a lot of bells tolling in Britain in the next couple of weeks, because the bell has well and truly tolled for Italy. Quite staggering, overwhelming numbers of dead, and the misery in the north of Italy can almost be felt elsewhere by those who love Italy and Italian people. But the good news there is that the rates of death in Italy, while still staggeringly high, have fallen for 2 consecutive days. Fewer people died on Sunday than on Saturday, and fewer people are dying today, according to the figures just out of Italy. So the social distancing, the quarantine, the discipline which is belatedly setting in the north of Italy might be working. France is in a bad place, Britain too, but Spain is the second worst affected by far. Some shocking footage out of Spanish hospitals of patients lying on the floor, patients lying in the street, and so on. It is extraordinary, as you say. And I was thinking when I was listening to your French report there, it is amazing that countries like France, like Britain, that go around the world projecting themselves as world powers, which are fantastically rich, haven't even laid in for a rainy day stocks of face masks. I mean, I've got a face mask, Manila, because I have an Asian wife who laid them in years ago, just in case we'd ever need them. You'd think these big, powerful countries might have done the same. Absolutely. I am myself an Asian wife, and we have a stock of those for any given reason, because you just never know. And as we know, the backlash amongst Asians across the world for having the stock of masks. But that's a whole different topic, George. Staying in Europe, you mentioned these staggering numbers in Italy. Glad to hear that they are finally beginning to fall, at least the death toll is. But do you think that Italian officials acted fast enough? No, I mean, nobody acted fast enough in Europe or North America, for that matter. The Russians acted fast, as you've just been hearing. I was in St. Petersburg and Moscow a few weeks ago, and whilst the tourist industry in St. Petersburg in particular is hugely dependent on Chinese tourism, there wasn't a Chinese tourist to be found, because Russia had sealed its borders and stopped all traffic from China at the first drop of this COVID-19 virus. And so some governments acted decisively and some did not. The British government is not even yet, according to much of the public opinion, acting decisively enough. There's obviously a tension between draconian measures and personal freedoms and so on, and the needs of public health. But I suspect that the latter is winning out and George, will be announced in the next day or two. With that said, for the time being, the UK is still a quasi-member of the EU. Should there be a uniformed response among EU member states to also follow suit like Russia and shut down all borders or do other measures to help flatten the curve? Well, it is odd that we've taken back control in order to allow flights from the most infected areas. Iran, China, Italy are still arriving right now at British airports. It's quite extraordinary. I believe I'm old-fashioned. I believe we should all follow the World Health Organization on issues like epidemics and pandemics. These have nothing to do with national sovereignty or politics. It's fatuous to be casting aspersions on this or that part of the world. We all need to pull together. And the best advice is the best advice wherever it came from. Me, I trust doctors rather than politicians. Yeah. And my own doctor warned me many, many weeks ago that this was going to be a thoroughgoing disaster.
And George, before we got to go real quickly, but Angela Merkel, as of now, we don't know if she has actually tested for COVID-19, but she is self-quarantining at this time because she has come under exposure of a confirmed case. U.S. Senator Rand Paul has officially tested positive for the virus. He's the first U.S. big-named official to be confirmed rather as positive. But Mr. Paul's staff says that he was showing no signs. He was asymptomatic. So the question then comes, you having been a lawmaker yourself, why was Mr. Paul tested? Do you suppose that given the scarcity of tests here in America, are public officials like U.S. lawmakers, are they cutting the queue? And should that be taken by all other global leaders?
Well, as President Trump said, I don't often pray him in aid. That's the way of the world. Idris Elba, the actor, got tested positive here just a couple of weeks ago. A lot of people were upset about that because virtually nobody in Britain has been tested unless they've arrived at the hospital already sick. And of course he paid for it, and I dare say Rand Paul has a shilling or two and paid for his own test. It's not the way I would order the world, but I guess that is the way of the world.
All right, we'll leave it right there. As always, appreciate your insights. George Galloway, thank you.